Hi, so today I am going to be narrating how to perform an enteral feeding through an open system and a closed system, and medication administration through an enteral tube. So, with all of these, I would walk into the patient's room, introduce myself, identify the patient by asking them their name and date of birth. Then I would wash my hands. I'd let them know what I'm there to do and make sure that it's okay with them. And then I would go ahead and provide privacy, and I would then move on to do an abdominal assessment. So I'd be checking for bowel sounds. I would be taking a look to see if there's any abdominal distension, and I would be taking a look at the insertion site of the tube to make sure there's no redness or drainage. And I'd be asking the patient if they've experienced any nausea, vomiting, or diarrhea recently. If all of that was good, I'd move on to taking a look at the MAR to check for the frequency of the feedings, the type of feeding, and the rate of the feeding. I would also be checking the MAR to if this was the first feeding since the tube has been placed, to confirm that there was radiology performed to make sure that the tube is in the right place. So then I'd move on to obtaining my formula and my equipment. So if it was an open system with a disposable feeding tube bag, I would take my bag and my administration set and the tube. I would prime the tubing, clamp the tubing, make sure my formula was wasn't expired, so I would check the expiration date. I would shake the formula, and I would pour the formula into the disposable feeding tube bag. I would then label the bag with the type of formula, the rate, the date, and the time. Then I'd make sure about 4 to 6 hour supply of the formula was in the bag. I'd go ahead and hang the bag, unclamp the tube, and allow for the feeding to begin. When the feeding's complete, I would flush the tube with 15 to 50 mLs of water, and I would disconnect and go from there. I would have the patient seated in that elevated position that I put them in the beginning, which is about 30 to 45 degree angle, for about an hour after the feeding is completed. Now, if it was an open system with the syringe, I would take the plunger out of the syringe. I would connect the syringe to the tubing, have the tubing primed, and then I would administer the formula into the syringe. I would elevate that syringe no higher than 18 inches above the insertion site, and as the feeding starts to empty the syringe, I would go ahead and administer more formula. And I would continue to do that until the prescribed amount of the feeding was completed. Then when the feeding was completed, I would go ahead and flush the tube with 15 to 50 mLs of water. Then I would clamp the tubing and disconnect the syringe. Now, if it was a closed system, I would take the pre-filled bag, the administration set, I'd prime the tubing, attach it to the tube, and I would hang the bag and set the pump at the proper rate. When the feeding was complete, I would shut off the pump. I would flush the tube with 15 to 50 mLs of water, and I would again keep the patient in that position for 1 hour after administration. So those are the 3 feedings. And now for medication administration. So I would do everything that I mentioned earlier. I would come in, introduce myself, identify the patient, asking them their name and date of birth, wash my hands, let them know what I'm there to do, make sure it's okay with them. Then I would check the MAR, do my 6 rites of medication administration, and the 3 checks against the MAR. If any of the medications weren't liquid form, I would make sure that the tablets on hand were able to be crushed. As long as they're able to be crushed, I would crush them, and each individual medication I would crush and add to 20 mLs of water. Then to instill the medications, I would administer them separately. Through the syringe, I would attach the syringe, unclamp the tubing, and I would start to administer the medications. So one by one, I would instill the medication, and after each medication installation, I would go ahead and flush the tube with water. And then I do the next med and flush, and the next med and flush, and so on and so forth. When all the medications are completed, I would clamp the tube, disconnect the syringe, and have the patient in that elevated position for about 30 minutes after administration. And that's about it. I think I covered everything, fingers crossed, and I think that's it. Okay, thank you.